evening. I'm Brittany Ramsey. Thanks very much for being with us tonight. The uncertainty surrounding Thunder Bay's Bombardier plant continues. Mayor Bill Morrow, along with other city officials, were busy over the past few days lobbying on behalf of the Bombardier operation and on other city fronts at the 2021 Rural Ontario Municipal Association Conference. Morrow raised the Bombardier issue in an online discussion with Ontario Transportation Minister Caroline Mulroney. After the meeting, Morrow says there are some red flags for him, as well as with a number of other people who are working on the file. He declined to go into detail about those red flags, but with the plant falling under new ownership on Friday, his concern is quite high.
We will be drafting a letter today or tomorrow with a lot of the concerns that we have relative to where this situation sits right now. The pipeline will be empty soon in terms of orders and work for the local plant. We think there are solutions to this, but we just need to see the province and the federal government and the City of Toronto in alignment. We think the money's there. We know the demand is there, but we still have some questions and some concerns.
Morrow, City Manager Norm Gale, and Councillor Brian McKinnon also lobbied Health Minister Christine Elliott to fund a mental health and addictions crisis center in Thunder Bay. The facility would have 40 beds, including 20 for crisis cases and 20 for addictions. And there will now be a Northwestern Ontario voice among the leadership of the Rural Ontario Municipal Association. Conwy Mayor Kevin Holland has been elected first vice chair of the organization. Holland also serves as the Zone 10 representative to ROMA. Regional mayors and chiefs continue to push back on recommendations contained in the new 10-year master plan for Superior North EMS. Among the major concerns are plans to decommission the Beardmore station and to amalgamate others along the North Shore. A group of regional leaders voiced their concerns to Thunder Bay City Council this week. Ryan Benazzo has details.
The new Superior North EMS master plan calls for the Beardmore station to be decommissioned next year. It's a move that residents in the area fear will leave them without access to emergency health care. Greenstone Councillor Claudette Trottier, who represents the community, accuses the service and the consultants who developed the plan of prioritizing cost savings over saving lives.
Since when do we compare lives to value for money? A word that best describes the actions of Superior North EMS is abandonment.
Todd McDonald, president of Performance Concepts Consulting, acknowledges that money does play a role. He notes the Beardmore ambulance is currently only in use about 3% of the time, and the station responds to fewer than 10 lights and sirens calls a year, referring to the most urgent cases.
In an era of finite resources, where can we best deploy and how can we best deploy the resources we have to benefit the highest number of patients in need?
The plan also calls for a single paramedic vehicle to be in Beardmore 5 days a week, including when the community health center is closed. Another recommendation is to amalgamate the Nipigon and Red Rock bases into one new facility and doing the same in Schreiber and Terrace Bay.
Schreiber and Terrace Bay are located 14 kilometers apart via Highway 17. A consolidated station in either community would result in longer response times.
But the report notes those amalgamations can't occur until after other changes are made, like freeing up ambulances by implementing a scheduled patient transfer system for those who need to come to Thunder Bay for non-urgent care.
We need to meaningfully solve the non-urgent transport along the North Shore issue before we can put our minds in a meaningful way to consolidating twin bases.
Regional leaders also object to the fact that they weren't consulted before the master plan was developed. Smith insists there will be consultation before the plan is implemented. An implementation plan will be presented to Thunder Bay City Council in the spring. Ryan Benazzo, TBT News.
12 new COVID-19 cases were announced today on what is the 10-month anniversary of the first COVID-19 case reported in Thunder Bay. These 12 cases put the district over the 300 mark for January, which is a single-month high. All 12 new cases reside in Thunder Bay and the surrounding areas. 3 are linked to the ongoing outbreaks at the District Jail and Correctional Center. 7 cases were contracted through close contact, and the remaining 2 have no known exposure. 16 previous cases are now considered to be resolved, bringing the total number of active cases down to 146. Meanwhile, Ontario is reporting 1,670 new cases today. That's the lowest daily case count in the province in the last 7 weeks. But the good news is being tempered by word Ontario will only receive a small percentage of the vaccines that it was expecting next week. Colin DeMello has more.
Ontario's supply of the COVID-19 vaccine is quickly running out. Of the 411,000 doses distributed to Ontario, 305,000 have already been administered, leaving 100,000 doses left. But the shortage of the Pfizer vaccine has forced the province to halt its delivery system. The focus is now on first doses for residents in long-term care and retirement homes and completing second doses for healthcare workers, while mass vaccination sites like this one are sitting unused.
All we need more vaccines. That's critical.
Ontario will be receiving more vaccines next week. More than 80,000 of the Moderna vaccine and nearly 30,000 doses of Pfizer. But it's much less than the province had budgeted for.
That's a total of 26,000 doses of Pfizer we'll get. The week after that, we do not yet know what we will receive in Pfizer or the weeks following that.
And now the country is dealing with a new concern, as the European Union threatens to restrict shipments of the vaccines manufactured in the EU. The Prime Minister says conversations with drug manufacturers have given him confidence.
That Canada is very much on track to continuing to receive doses of vaccines for Canadians. We are on track to getting more than 3 million Canadians vaccinated by the end of Q1.
There could also be a major change when the next shipments finally arrive. Health Canada is considering whether a sixth dose can be squeezed out of a single vial instead of 5. Canada could soon have a homegrown solution too, as Providence Therapeutics begins trials of their vaccine in Toronto.
We really need to invest in homegrown solutions to vaccination so that we actually have some autonomy. We're relying on foreign companies that are in foreign countries to produce and ship vaccines to us. And we've already seen the hurdles that this can pose.
While it is a distant dose of hope, it would not come in time to cut down the second wave of COVID-19.
The outbreak at Thunder Bay's Correctional Center has likely hit its plateau, and while the numbers are still quite high, the union president representing workers at the facility says staff should be commended for their commitment to following COVID protocols. Corey Nordstrom has more.
The facility-wide outbreak of Thunder Bay's Correctional Center is now affecting 48 male inmates at the facility. As well, a single female inmate has tested positive, along with 6 staff members.
When you look at it, we're approximately 94% inmate infection rate, but about 3 to 4% staff rate.
Sean Bradshaw attributes the disparity in those numbers to a strong focus on personal protective equipment and strict measures put in place to isolate staff, with workers going from a hotel room to the correction center with little flexibility.
Clearly, we're doing something right, and if anything can be taken from this, is that exercising proper PPE is being effective. Nobody wants to be away from their families, but we're doing what we have to keep them safe and keep the public safe.
Bradshaw says tests are being done about every 5 days, with results coming back in just a day or two. The high infection rate in the male population leads the union president to believe that things can only be improved upon.
Well, the male dorm at the Correctional Center will get better in the next 10 to 15 days, which in reality isn't a really long period of time. What we're going to see is probably a few more staff, to be honest, a few more staff test positive over the next week or so.
His biggest concerns lie in the female dorm, where we may be seeing the calm before the storm, and the district jail, which has a revolving door of inmates in comparison to the correctional center. Corey Nordstrom, TBT News.
The NDP continues to take the Ford government to task over its handling of the pandemic in Ontario. The virus has been making its way through multiple First Nation communities, including Ganoogaming and Constance Lake, where both have declared a state of emergency. Kiiwetinoong MPP Sol Mamakwa is calling on Premier Ford to provide a COVID-19 specific isolation site for residents that have tested positive, as well as access to and delivery of COVID-19 rapid tests.
Kinakaming, for example, have been calling on extra nursing support as it works to stop further spread of COVID-19 in the communities. The virus has broken through through the community's lines of defense, so we need to be able to address that. So that's cause for concerns for sure when you have limited access to healthcare services in the north.
Thunder Bay will soon have a new tool to track the presence of COVID-19 in the community. Officials with the city's Environment Division say they will soon begin regular collection of wastewater samples from the pollution control plant to test for the presence of the virus. It's part of a 2-year province-wide study to help track COVID-19. The city's chief chemist, Ian Morgan, says initially only 1 sample a week will be taken to provide a baseline, but that will soon increase to 3 samples a week. Those samples will then be sent away for analysis and the results sent back to the district health unit. Data from previous wastewater studies have proven that the results closely parallel the results of community nasal swab testing. It's been just under 2 weeks since the new warming center on Victoria Avenue opened with the goal to help Thunder Bay's homeless population. During that time, an average of 60 to 75 people have been taking advantage of the new center each day. Avery McRae has more.
After first opening its doors on January 15th, the Victoria Avenue Warming Center has seen a steady stream of Thunder Bay's homeless population take advantage of the new facility. Operated by PACE, the center is open from 8 a.m. to 8 p.m. each day. It's a place where the city's vulnerable population can warm up with a hot drink and a snack and enjoy some TV. Users are spread out to promote social distancing, with COVID restrictions putting a capacity limit of 10 to 12 people inside at one time. Kyle Watson has been using the warming center each day since its doors first opened and has had nothing but a positive experience.
It's great, the experience in here. I feel that everything is lifted off of me when I come through here. Very spiritual.
Everybody loves it. They're very appreciative of it. We haven't had any incidences over there. We've had the police bringing people to us. We feed them. They leave here feeling better than when they got here.
The center is seeing an average of 20 to 30 people come through the door during the day and 50 to 55 people after 4 each day. On busier days, users are limited to just 30 minutes inside. With the malls and other facilities closed due to COVID-19 and the city's shelters near full capacity, Watson says the need for the warming center is more important than ever.
It gets people out of the streets for a bit, and they have access over here on the other side too. There's just this side and next door there, but computers, access, warmth, it's great.
We service about 80% of our clients are homeless, and our hearts break for them. So we're really, really happy to be able to do this, and we thank the City of Thunder Bay for giving us the funding to be able to make it happen.
With the success of the facility, McKinnon is hopeful the warming center will make a return next year and the years following. Avery McRae, TBT News.
OPP have made an arrest after a disturbing incident in Pekanjikam. The charges follow what police describe as a possible drowning involving a 2-year-old child back in August of 2020. The toddler died after being airlifted to the Winnipeg Children's Hospital. The investigation involved the Northwest Crime Unit, the OPP's Forensic Identification Service, and the Office of the Chief Coroner. 25-year-old Helen Fiddler of Pekanjikam is facing charges of criminal negligence causing death, abandoning a child, and failure to provide the necessities of life. Fiddler has been released from custody on an undertaking and will appear in court on February 24th. Quicker emergency response in Fort William First Nation will soon be a reality. Chief and Council have signed off on a training for a group of volunteers to become a medical first response team. Mason Morisseau has 4 years of experience with St. John Ambulance, and this team is something he's been trying to organize for years. When 911 calls direct Superior North EMS to the reserve, the call will also be directed to his group. Each of the members will have a trauma kit in their personal vehicle, and Morisseau believes the quick action can be the difference between life or death for some residents.
With the response times being so long from the city, and finally getting this going, can hopefully save lives. Obviously, with the response times going out to Squaw Bay and further, having the trained first responders in the community will definitely help kind of mitigate the loss of life in the community.
About 25 individuals have expressed interest in joining so far. Those looking for more information can visit the Medical First Response Team section of the First Nations website. Morrisseau hopes to have training from the Ministry of Health up and running by late February, and should everything go as planned, having the first responders available by mid-March. The United Food and Commercial Workers Union is reacting to news the Safeway on Court Street will be converted to a Freshco store. The union represents about 85 employees at that location. Renovations will force the closure of the store this spring before it reopens in the fall under the Freshco banner. The union says it's disappointed with Sobeys' decision to convert the store, especially given the ongoing pandemic and the challenges employees have already been facing. However, the union says it's prepared to enter negotiations with Sobeys with the focus on protecting the affected workers. The pharmacy will remain open during the 4 to 5 months of construction in a temporary location at or near the store. The annual Introduction to Kindergarten event held by the Lakehead Public School Board will have to be virtual this year. The event helps parents, guardians, and of course, the new little students that are starting school for the first time. Normally, parents and guardians of children entering kindergarten are invited to a citywide in-person event that introduces the various aspects of kindergarten, including transportation options. Principal of Early Years Programs at Lakehead Public Schools, Eric Fredrickson, says the virtual event coming up on February 1st will be just as informative and interactive. A new video will also be launched with more information on this unprecedented year. He says last year's video gives an inside look on a typical day in the classroom.
Following the video and the activity with the educator team, there'll be videos from our staff, our director, our chair of the board, senior administration, an educator team, and then parents will have access to a number of videos and resources that they can watch while their child or children are doing a follow-up activity. And we knew that trying to replicate an information night online is, we don't want it just to be a list of videos for people to watch. We wanted it to be interactive and something fun for kids to do as well.
The virtual event happens next Monday evening starting at 6:30 and will include an online read-along by a kindergarten teacher and an early childhood educator.
Well, Fiona, blue skies, plenty